me, there will be days that you want to stop. There will be days that you want to stop. I've had so many days that
days, because we all have such
like
a days.
like I said, you should have a reason for going to the gym. I had a very good reason. My reason is I don't want to become old and get sick.
Yeah.
I don't want to spend all my money buying medication. Right? Because we are all struggling in this world to make money. I don't want to get my money and then I'm going to hospital every day buying medication. No. I don't want to do that. So on those days that I don't feel like going to the gym, and I remember, hey, yes, that diabetes is real. Hey, yes, that hypertension is real. So I'll be on my bed and I'll remember. Exactly. This is the reason why I started. So you always, that's what I'm saying, you need to have a good reason for going.
I think we're doing this, yeah, finally. Like, I've been thinking about starting this podcast for about 1.5 months, and yeah, like, there was never a good time for me to start. Every time I would say, oh, I'll do it tomorrow, or I'll give excuses that, nah, I don't think I'm ready, I don't think this and that. Oh my god, man, there was never a good time to start this. But you know what? This is the time. We are starting it, and there is no turning back. This podcast is called LyLu HealthTalk. LyLu stands for Live Your Life Unregrettably. So the LyLu HealthTalk podcast is a subset of a business called LyLu Health. It's a startup that we are about to launch very soon. So please stay tuned on that. Stay tuned on that. Yeah. So for this podcast, we are going to be talking about anything and everything to do with health. I'm going to be inviting special guests. Those guests will be either health practitioners or health enthusiasts who have things to share with us. So I'll be just crafting a number of questions and then have a form of conversations with them, so that we can get to learn from their expertise, and they can also get to teach us like different ways on how to live our lives unregrettably. And so for the very first episode, I wanted us to discuss about the importance of physical activity. So I've invited a special guest. She's called Dr. Esther. She would briefly introduce herself, but she's a medical doctor, and she's a TV star and an entrepreneur, and she's very passionate about fitness or physical activity. And I thought she has so many things to share with us, because I know from when she started exercising and the kind of impact it has had on her life, and she also have like personal touches to share with us on what motivated her to actually kickstart the fitness journey. You guys will be blown. And also, to give you a heads up, I'm actually meeting her at her gym. Yeah, and there could be some noise in the audio, but please just listen in, because you don't want to miss anything or anyone that she says, because man, she's incredible. She has so many good things for us to learn from. And yeah, I promise you next time we'll record from this place or other places that are quieter. So please, my sincere apologies. I mean, we are starting and trying to figure out so many things all together, and so please, you bear with us for now. Yeah. And so briefly, before I go to meet her, I just wanted to share with you a particular statistic. When I was researching for this podcast, I came across a statistic by the World Health Organization. They say that 1 in 4 people actually meet the recommended or the required amount of physical activity. And this means that there is still a huge gap, or there is still a number of people who are actually not indulging in physical exercise, and it's actually affecting their health drastically, because we know that physical activity is one thing that improve your mood, boost your immunity, functionality, and also helps your heart rates. So it has so many health benefits, as we are about to uncover with Dr. Esther. So please stay tuned, and see you there.
So please help me welcome Dr. Esther. I'm not going to steal her show. She's going to take us over. Maybe if you could start by briefly introducing yourself, and then I'll be asking you a few questions.
Okay. So like she already said, I'm Dr. Esther Agbozo. Currently, I'm a waiter at the Municipal Hospital. I also run a private medical consult. It's called EA Medical Consult. So for EA Medical Consult, people can come and book online for consultation. Either you want it online or you want it in person. Also, like you said, I'm a TV
Start.
right. So I do a lot of TV interviews on different health topics. I'm very passionate about sexual and reproductive health and then mental health. And more recently, I've become very passionate about fitness. Anything fitness we find out there. I think that's a little introduction.
Yeah. So we'll start with some of like a few warm-up questions, and the first one has to do with us understanding what physical activity really is. So what does physical activity really mean to you, and does it have to be intense to be effective, or any small amount?
Right. Yeah. So you see, when we talk about physical activity, it's any sort of movement at all that relates to you expending some energy, right? So any movement at all. So it can be walking, it can be running, it can be dancing, it can be something as simple as yoga, you know. So it always doesn't have to be intense. It's not always cardiovascular exercise like jogging or aerobics and all that. There are other anaerobic exercises that can also lead to you losing some energy. So anything that will lead to you losing energy can be regarded as physical activity, right? And like I already said, it doesn't have to be intense. Because people who do like yoga, people who do meditation, even though they are doing some movement, it's not very intense. Again, they are using some amount of energy. So any activity that you do that involves any form of body movement and you are losing some form of energy, can be regarded as physical activity.
Thank you so much. The second question has to do with us knowing what's motivated you. Like, how did you kickstart this fitness journey?
Wow, interesting. So my fitness journey started in December last year. I think my big sister and I we woke up one day and we decided that we did not want to end up with any form of cardiovascular disease. We did not want to end up with diabetes. We did not want to end up with high cholesterol levels. But I am a medical doctor. Sitting in the consulting room, I see lots of patients coming with lots of health conditions. And most of these health conditions are because of a lack of physical activity and poor diet. Right? So we are not going to wait till we get a hypertension. We are going to do what prevents us from getting the hypertension. So we woke up one day and decided that we are entering the gym. I think my big sister was even more motivated than I was. I was shy, but she, motivated me. Oh, we should go, we should go, we should go. We went, and I enjoyed it. As we went along, by the third week, I realized that I was seeing a lot of changes in my body, and so I became excited. I was like, oh, this thing is actually working, right? So that has been the motivation. So the motivation main has been just trying to stay healthy. I want to be that 82. I recently watched a video. I saw an 82-year-old woman who beat a thief who came into her house, right? So I want to be that 82-year-old woman who can still walk around, do everything that I have to do. If a thief should enter my house at 80, I'll be able to beat them up. Right? Yeah. So basically, that has been my motivation. Just stay healthy, be in shape, and then look at the long term goal, which is if you get old, how do you want to bedridden so that people have to carry you around? Do you want to end up with maybe a stroke and not be able to do anything, or do you want to be that old person who can still do everything and they're independent? I want to be independent.
Yeah. Why is exercise considered a non-negotiable for long-term health?
Exercise is non-negotiable. You see, it's unfortunate that most of us are not taught these things in school, even when we are growing up in our homes. I don't know if you ever saw your parents being, because I used to see my dad jog a little bit, but apart from that, no big physical activity in our homes. Nobody really tells us that we have to exercise. But data has shown that exercise prevents us from getting a lot of diseases. I'm a medical person, so when it comes to most of these health conditions, I understand them well, and I know the implications for somebody's quality of life and all that. And so it's very important because it's going to prevent from getting a lot of, we call them non-communicable disease. So it means that you don't necessarily, it's not infectious. You get it on your own. Something like hypertension, something like diabetes, something like high cholesterol levels, right? And these health conditions can lead to other things. So we are looking at long term, your kidneys can fail if you're having hypertension and diabetes. you can end up with a stroke, right? And so when you begin to do physical activity, it reduces your risk of these conditions drastically. And even more recently, data has even shown that physical activity reduces your risk of getting cancer. So some specific cancers have been shown to your risk of actually getting it cancer are very less if you are involved in exercise. Breast cancer is one of them, which is very common amongst women. Prostate cancer is very common amongst men, right? And so all of these things are some of the reasons why I think physical activity is not negotiable, right? And even when you look at the long term, if you are somebody who is very physically active, you are in shape. If you get old, obviously your joints will still be strong, your muscle will be strong. Now, it says if you want to be able to move around in as an old person, have good muscle mass that can help you.
Yeah.
Physical activity is not negotiable.
Yeah. I think this has it connects to the second question I wanted to ask about the science behind physical exercise and the muscle,
The muscle mass,
muscle mass. I think
yes,
it
explains.
explains.
Yes.
And so, how does physical activity help prevent or manage common conditions like high pressure and diabetes or depression? Like,
Right.
is it like a cure, or does it have some? Does it produce some hormones that actually makes this condition manageable? Because
Right.
I know they're not like uh,
They
they
can
are
be
permanent.
cured. Yes, yes. Now, the thing is that if you are engaged in physical activity, right, first of all, you can prevent these conditions to start with. Now, let's assume that you've already been diagnosed with maybe hypertension or diabetes, right?
Yeah.
When you come to the hospital, the very first time we make a diagnosis, we are usually not even in a hurry to put you on medication. The first thing we tell you to go and do is lifestyle modification. What is lifestyle modification? Physical activity and diet. That's lifestyle modification. So we tell you begin to exercise more. So if you are maybe an old person, we may tell you to begin to walk short distance maybe in your house. If you jog a little, you jog. If you don't go to the gym, hallelujah, you go to the gym, right? Then we tell you that you need to eat well. So you need to cut out some foods from your diet. So when you come to the hospital, we do lifestyle modification. If it doesn't work, or if you are not able to do it well, because most of our patients are not able to do it well. When you tell them to go and exercise, they will just go and lazy and then come back. And if you come back and your BPs are still high, then we have no choice but to put some medication. But people who have been very diligent with lifestyle modification, they will come back and their BPs have normalized. They will come back and their sugars have normalized. So there's no need to put them on medication. You only encourage them to continue the path on which that they are already on, and then that prevents them from getting the condition. But for those who have it long term already, let's assume that you were diagnosed 3 or 5 years or 10 years ago, physical activity is still important because data has shown that once you begin to exercise, you begin to drop your blood pressure, right? And so if you're hypertensive when you're exercising, you begin to improve on your some of the exercise we call it aerobic exercise. These exercises are cardiovascular exercise. They actually work on your heart, right? The health of your heart. So once you begin to do these exercises, even if you're hypertensive, the BP should begin to drop because my heart is building capacity because of the exercise that you're engaged in. Of course, we will not say that if you're hypertensive, you're going to do very vigorous activity. And no, not until you start slow. Then your heart begins to build capacity. Your heart begins to build gradually. Then you see that eventually, by the time you come to your BPs begin to. I've watched a video where the woman said she was hypertensive, she was on medication. But when she began physical activity, BPs were dropping. But they got to when the doctors asked her to stop taking the medication, because once you take the medication, the BPs go very low. Because when the BPs are normalized. So if people begin to take physical activity very diligently, I believe that most of the people in our part of the world who have diabetes and hypertension, they should, they will be having a solution. Yeah, they will have to stop taking their medication. But unfortunately, just a few people are actively diligent with physical activity. So that's where we are where we are.
Text courage.
Yeah.
And for those who feel tired all the time, how can exercise actually boost their energy instead of draining it?
Right. So you see, when you are tired, okay, there are hormones that are released. A lot of the things that go on in our body are regulated by hormones. So usually when you are stressed out, you have a hormone called cortisol. That's really now cortisol will make you feel tired, lazy, not motivated, and all that. So you are stressed. Now when you begin to exercise, there are different types of hormones that are released. We call them the feel good hormones. So we have the likes of dopamine, we have the likes of serotonin. So these hormones are hormones that naturally stimulate your brain to give you some form of energy. Now when you exercise too, because you exercise and these hormones are released, it puts you in a very relaxed state. I can testify that whenever I exercise and I leave the gym and I get to the house, my sleep is different from the days that I've not gone to the gym. Because your body, your brain is already signed up that you need to rest because of all the feel-good hormones that are being released. But once you don't exercise and there are no hormones that are coming in, of course, cortisol levels are.
And for those who actually join fitness for the sole purpose of losing weight,
Right.
does it actually work? Because I have friends of
course.
mine. I have friends of mine.
Okay.
I think I could maybe speak to myself for myself. Many times I went to the gym with the sole purpose of losing weight. I don't know if I was doing. I don't know what I was doing wrong not to be able to lose weight as much as I wanted to. But I don't know if it actually works. So
It
can you
does.
help us like
It does. I think that it depends on what you do when you go to the gym, right? It depends on what you do when you go to the gym. Tell me that going to lose weight or not. Now, I have to say that going to the gym should be all about weight loss. Yeah. Because if you are looking at just the figures on the scale, you may actually be becoming healthier, but the scale will not reflect that. Yeah. Why am I saying so? If you are in the gym and you're exercising, you are burning fat and you are building muscle, you should understand that the muscle is replacing the fat that is leaving. So your weight may remain the same, not because you've not lost it, you've actually lost some fat, but you replace with muscle. Yeah. So your weight on the scale may remain the same, but you become healthier, you become stronger, right? So now your body composition has changed. Just that the figure on the scale is still the same. However, depending on what you do and even your start weight when you go to the gym, if you are somebody who has a lot of fat when you go to the gym, I can use myself as an example. When I was starting at the gym, my weight was over 100 kilos, right? I think I was somewhere around 109 kg when I was starting. And one of the reasons why I also went to the gym was I wanted to, as much as I wanted to be healthy, I also wanted to lose something, right? So when I started, I was doing it. My trainer told me, I think that again, when you are starting, you should have a coach. But if you go to the gym, you don't know what to do. You don't have any coach. But
very important?
Yeah, very important.
Maybe that's what I was
yes, I
lacking.
think we should have a coach. I had a coach. Shout out to this man called coach. Yes. So he, helped me. I was doing a lot of cardiovascular exercise, a lot of aerobic exercise. So at the gym, we have aerobics on specific days. We do aerobics, which are like high intensity exercises over like 1 to 2 hours, right? And so those exercises actually help you to burn a lot of fat, right? And then you do some weight training as well. A lot of people think that weight training is just for the people who want to build muscle. No, weight training actually helps to get rid of fat as well. So I was doing a lot of weight training combined with aerobic exercise, and it worked for me. Right? I think I've lost like over 20 kg. Wow. This has been since December. So this is about 7 months now, right? Wow. So yes, in about 7 months, I've lost about 20 kg. So the weight loss is very possible. But it depends on what you do. It depends on what you eat when you go back home. But for instance, if you don't do an exercise and you go back and you eat a full bowl of food 3 times a day, you've just done post night. You're just eating what you went out. So again, the weight will remain the same. So it depends on what you do in the gym. A coach who is going to teach you what to do and do it right. And then your diet is also very important because you are eating too much that you are losing. Of course, your weight is going to.
And if you could share with our audience, like how do you incorporate your exercise in the diet? Like how many times do you eat in a day? What kind of food are you taking?
Right.
The water quantity, like all that matters.
Right. Yeah. So when I started, I had the weight loss also at the core of everything I was doing. So at the time, when I was going to the gym, even when I go to the gym in the morning, I didn't when I go in the morning, I don't feel good. What's I mean? I want to believe that the hormones that I release when you're exercising sort of suppress hunger, right? And so when you are done with exercise, usually for me, I don't feel hungry. So sometimes I'll go till about noon in 1 or 2 p.m. That is when I'm eating my third meal. But during the exercise, of course, I drink a lot of water. When you're in the gym, you can drink 3 liters of water without even realizing, right? So I used to drink a lot of water. Now, when I eat that third meal, I eat anything I want to eat, a proper meal, not something scanty. So if it's rice, I eat what I eat. Just I make sure I have a lot of protein in there. So the egg, the fish, the meat are in there. Then that is my main meal for the day. Then later in the evening, if I'm feeling hungry again, I will be looking more at the vegetable. So I used to eat a lot of fruit. So any fruit, mango, pineapple, watermelon, banana, of course, any food that you can do fruit mix, what do I want to do, right? That was what I used to do when I started. Then I was drinking a lot of water. Because when you drink a lot of water, it gives you the feeling that you're full, right? So sometimes it can help you not suppress the hunger as well.
And also regulate your intake
Yes,
of calories.
yes, right. So, and the water content, like you're saying, if you don't drink water at all, at least you should be drinking 2 liters of water. That's
An adult.
yes, for adults. Yes, for daily water requirements about 3 liters. They should be drinking at least 3 liters of water every day. Right? If it's like sachet water, that's like 6 of them. Each of them is 500 ml. So drinking a lot of water, eating. For me, I would eat what I wanted to eat. People used to think that maybe I stopped eating my bamboo and no, I didn't stop. Just I was eating them once a day in the afternoon. And once I eat it afternoon, usually you don't go hungry till like maybe 8 at night, 6, 7. If I do go hungry at that time, I drink water.
Thanks a lot for sharing your personal
Yeah, that's
routine.
but I
That
have to
might
say
work
that
for others.
that is what worked for me. It may not work for everybody. Some people always want to eat breakfast, right? Because some people believe that breakfast is important to
Meal of the day, yeah.
that is what some people think. So if you think you want to eat breakfast, you can still regulate how much calories you are putting in. So maybe instead of eating a very heavy meal in the afternoon, you do a light meal in the morning, do another light meal in the afternoon, and then do what works for you. But I believe that some people to benefit the route that I took.
And so the next set of two questions I have for you is to do with the lifestyle integration. Because of our busy schedule, some of us don't feel like we even have time to exercise. And so my first question is, how do you balance exercise with a busy schedule? And like, what does minimum effective dose of exercise look? Should I go and do a 30 minutes workout or a 1 hour? Like, what's effective given the required activities of the day that
So when it comes, I mean, everybody's working, everybody's busy. I have a very busy schedule, believe me, but I always say that if there is a will, there is a way.
yeah.
Because I remember there were days that I have to get to work by 8 a.m. to go to the gym at dawn around 5. So you may have to find a gym that opens 8. Yeah. I was fortunate that my gym opens at 5 a.m. Yeah. So I'll still go to the gym at 5. Sometimes I'll stay there till like 6:30, then I'll rush home, get back and get straight to yeah. So depending on what your schedule looks like, if you want to do morning or evening, whichever works for you. Morning works for me. I prefer to wake up, exercise before I go out, home with my home. And also because my gym has aerobic exercise. So if you have a busy schedule, I believe that even as busy as you are, there is time in the day that you find to eat. Right? There is time in the day that you find refreshment. Yes. There is time in the day that you find to watch movies. Okay. And so I believe that no matter how busy you are, if you put your head to it, you find the time. You will find the time. You will find the time. But I do 12 hours. I go to work from 8 a.m. to 8 p.m. And I still find time to go to the gym before I go to work. And I still going to take my 12 hours. The next morning, I'll still go to the gym, even though I was tired from work the previous day. I believe that it's your mindset. If you put your mind to that, you can actually you find the time. You will find the time. If you are not sure about it, or you don't know what you are looking for, make excuses with work here and there. Yeah. Now you're asking about minimum goals and intensity of it. The thing of the matter is, I don't think that one should fix all. And again, looking at the schedule that different people, somebody may go to the gym for this 30 minutes and then because that's a lot. Right? Somebody go to the gym, stay there for 2 hours and everything. So if you know that you have this 30 minutes to spend in the gym, when you get to the gym, focus. Some people will come, exercise more, talk small, make friends here and there. I remember when I started, I didn't have friends in the gym. The only friend I had was my coach, right? Because I knew what I was looking for. I came there to mind my business. When I come, I do what I came to do. I take my bag, I go to my house. I didn't come to make friends. Some people may think that you are not nice and all that, but if you know what you're looking for, you have to be focused. Right. So if you know you have this 30 minutes, you have this 1 hour in the gym. That is not the time to come and converse and try to socialize here and there. No, you have just 1 hour. So you come, you do what you have to do in the 1 hour and you leave. Right? You have just 30 minutes. You can still do a lot in 30 minutes in the gym and you still do. Right? So it always doesn't have to be a lot of time. But of course, on days that I don't have work, I can spend as much as 4 hours in the gym. That's how much I like being there. Those are the days I'm doing like maybe weight training and all that. For those days I can be there 3 hours, 4 hours because I have a lot of time. On the days that I don't have a lot of time, Even if it's 30 minutes, I'm focused. I do what I have to do and I go back.
Yeah, yeah. Thank you so much. The next question was about the food, like the diet, but you touched base on
Touch
it.
on that.
Again, it's very important to exercise as well as mind your diet. It's not like you're going to exercise and you go and
Go back and eat junk. No,
three
no,
days.
no, no, no.
Yeah, and so the next set of questions has to do with motivation and habit building. Like you want to understand what motivates you besides your intrinsic initial
Right.
conversation that we had. Like, and then so maybe I will just put in a form of question. Like, what's your advice to someone who keeps starting and stopping? And like, what is your motivation that gets you going, even when you don't feel like it, besides your personal fear to get sick?
Right. Believe me, there will be days that you want to stop. There will be days that you want to stop. I've had
So
so
what do
many
you do
days
on
that
those days? Because we
you
all
see,
have such those days.
like I said, you should have a reason for going to the gym. I had a very good reason. My reason is I don't want to become old and get sick.
Yeah.
I don't want to spend all my money buying medication. Right? Because we are all struggling in this world to make money. I don't want to get my money and then I'm going to hospital every day buying medication. No. I don't want to do that. So on those days that I don't feel like going to the gym, and I remember, hey, yes, that diabetes is real. Hey, yes, that I have hypertension is real. So I'll be on my bed and I'll remember that this is the reason why I started. So you always, that's what I'm saying, you need to have a good reason for going. Nobody came to the gym because they want to tone their body. So maybe if you don't feel like going, remember that, hey, I want my body to be toned, then you get up and go. If you're a guy, you think that, oh, you want to build muscle, you wake up, you remember, hey, I want to, look a certain way. That should be your motivation to wake up every day. So you should have a very good and tangible reason for going to the gym. Whenever you don't feel like going, go back to the primary reason why you went to the gym. Right? Once you go back to that primary reason, you always find motivation to go. Now, the other thing is that when you become consistent, you do it for a while, you begin to see changes in your body. Once you begin to see the changes, it is more exciting. You will not stop.
Never
Because I
go
remember
back
when I did it
again.
for 3 weeks consistently, I think I was going to take about 6 times in a week, and I did it for 3 weeks. I went to stand on the scale and I had lost 9 kgs. Nobody
You're
told me
like,
to keep
nah,
going.
this has to keep going.
The excitement was just too much. I was like, I have to continue. I can't stop. And the truth of the matter is that going to the gym is addictive at some point. When you do it consistently for about 3 to 6 months, it actually becomes addictive. So I've gotten to a point where if I wake up and I don't go to the gym, it feels
Feel
like something
bad.
is missing, right? So if you do it consistently 3 6 months, you get to a point where it becomes a part of you. That even as you are planning your week, you always know that there's going to the gym is part of going to. It's like going. It's more or less like secondary to your work. It's part of your schedule, right? Once you get to that point, there's no going back.
I know, I know. How long does it take for one to actually get addicted to the gym? For you, it was 3 weeks. But typically, how long do you think one needs to
I
be
think if
able
we are being fair, maybe average, we can say maybe 3 to 6 months, right? Because it depends on you have to set realistic goals for people. If you tell somebody that to happen for them in 3 weeks, they come and in 3 weeks, it doesn't happen, they stop. Right? So we have to have realistic goals. If you are doing it consistently for 3 to 6 months, I believe that you begin to see the changes in your body if you are doing it right. Because there are some people who still do the 3 to 6 months, but they'll do the wrong things. Right? I don't want to say it, but there's a typical example in my gym. I've been seeing her for about quite some time now. She does the same thing over and over. Trainers have spoken to her. She doesn't listen. And we are not seeing the changes that she's trying to do. So if you're doing the right thing, right, and you're doing it consistently, you begin to see the changes. To inspire you to keep coming, to motivate you to keep coming. Because you yourself, when you look in the mirror, you'll be excited at what you see. And so you will want to keep showing up. Right.
that's the thing.
Yeah.
And so I want to also touch base on the mental health aspect. I know you are into that space. And really do. Like I think from our okay, maybe I'll dedicate a special podcast to talk about how we
Yes.
met and then kind of what we were doing together. But for the mental health aspect, do you think exercising also helps with mental health relief and stress? Like, and how does it do it?
100%, 100%. Like we mentioned earlier, when you're exercising, the hormones that are released, dopamine, serotonin, right? When you look at conditions like depression, you look at conditions like anxiety disorder, when you look at the likes of the bipolar disorder and all that, most of them are because of a deficiency in some of these hormones. So people who have depression and anxiety disorders are people whose hormones, I mean, with regards to these hormones, their hormone levels are low. right? So some of the medications that we give them are even to replace some of these hormones. Some of them are like synthetic form of the hormones that I'm talking about, the serotonins and the dopamines and all that, right? So once you begin to exercise, your brain begins to stimulate your body to produce the hormones naturally. Automatically, if you are having depression, you are releasing the hormones that are supposed to cure the depression, so the depression is over. If you're having anxiety disorder, you're releasing hormones that are supposed to take care of anxiety disorder. So again, it's going to take care of it. So, and like I said, once you're exercising, the levels of the hormone that we call the stress hormone, that's cortisol, begins to go down automatically. And so your mental health, when it comes to exercise, if you're exercising or engaging in physical activity, your mental health is always going to be on point.
Before we reach to the fun and quick final round, the last question I have for you, what do you wish many people knew or understood about the infertility?
Right. So I guess a lot of people know the benefits they get from engaging in physical activity. The same gets up a lot of money, a lot of headache, a lot of trauma, plus preventing a lot of illness, prevention like BP, high cholesterol, cancer, and you said yourself a lot of trauma, lots of illness, right? Unfortunately, a lot of people do not see that as important. And finally, a lot of people think that physical activity is just for party. People think that only plus size is supposed to be. So if somebody skinny or slim, they think that they have no business with physical activity. That is wrong. I am in the country. I've seen so many people have attention, so many people that many people, the fact people that you expect to have these conditions don't really have them, right? So don't think that just because you are skinny, you don't need to exercise. Everybody needs to exercise. From the skinniest to the most plus size, everybody should engage in physical activity.
So with our last section, we just want to understand you more, like what's your favorite way? So the first one is, do you prefer push-ups to squats?
Of course not. I fresh fast push-up. Squats any day, anytime. I don't like push-up. My trainer knows that.
I relate.
Yeah.
And the second one is, do you prefer doing your exercise in the morning?
In the morning. Except on Mondays and Wednesdays. Mondays and Wednesdays when I'm not working. I do both morning and evening. But on a normal day, I prefer to go in the morning.
The third one is, do you prefer to work out alone or do you prefer to have a buddy?
It depends on what I'm doing. On the day that I'm doing like cardiovascular exercise, I usually prefer to do it alone. Because that one, I'm able to focus. If I'm sitting, I can see. If I'm on the treadmill, I can do that. If I'm cycling, I can do that. But if you are doing like weight training, usually it's nice to have somebody so that as you do your set and you're done, they also do their set and you're resting. You can converse and take videos and pictures there. So it depends on what I'm doing.
It's feeling late today.
Stop feeling lazy. Get up and go to the gym. Go to the gym. Okay.
Thank you so much. I think this brings us to a close.
Right.
But for the audience who are following us, like if they want to connect with you, where should they find?
Okay, so you can find me anywhere on social media: Instagram, Facebook, TikTok, Snapchat. It's the same thing. Here the medic. Here is EY. That's just my name. Underscore there. Underscore medic. Here the medic on all social media platforms. And even on YouTube, I have a YouTube channel. You should check that out as well.
Go there, like and share.
Yeah.
Yeah. So thank you so much, Dr. Esther. It was lovely to have you for our very first episode. This really means a lot to me. I wanted to. I don't know. This felt like the most important topic to begin our podcast with, because I know that physical exercise is at the core of every other health thing that we have to talk about today. And so, thank you so much for your time. See you. Thank you so much. Bye.